All right, everyone, welcome to today's Clinical Lab Session Explainer. We are taking a massive leap forward in your training today. We're basically taking all that textbook theory you've been reading and transforming it into real, hands-on clinical mastery. I'm going to be right here guiding you step by step through the art and the science of soft tissue manipulation.
Look, it's one thing to just memorize definitions for your written exams, right? But it is an entirely different ballgame to translate that theory into a clinical touch that is safe, effective, and professional. You have to remember, the examiner isn't just watching your hands. They're watching your body mechanics, your safety protocols, and how you communicate with your patient. Okay, let's dive into this.
So, here's our game plan for today. We'll start with preparation and patient safety, then move into stroking and pressure, followed by percussion and vibration. After that, we'll cover lines and pressure and wrap it all up with exam mastery.
Starting off with Section 1, Preparation and Patient Safety. This is literally your foundation.
I need you to absolutely burn the 4 P's of preparation into your memory. First up, patient prep. You always explain the procedure, get consent, and actively screen for contraindications. Second is position. Your patient has to be comfortable, and the body part needs to be fully supported. Third is privacy. Strict draping protocols are a must. You only ever expose the segment you are actively treating. And finally, pressure plan. Things like washing your hands, taking off your jewelry, and getting yourself into a stable stance so you can use your body weight, those are non-negotiable ground rules before you ever lay hands on a patient.
Now, safety really means knowing when not to treat. I want you to memorize this mnemonic for absolute contraindications. DIM BUS. That stands for deep vein thrombosis, infection, malignancy, bleeding disorders, unhealed fractures, and skin disease. If you see any of these, you stop. Hard stop. On the flip side, we have relative contraindications, things like pregnancy, varicose veins, or osteoporosis. These just require some careful modification of your technique. But remember the golden rule of clinical touch. Some discomfort during deep friction might be therapeutic, but sharp pain is a signal to stop immediately.
Now, what's really interesting about this slide is how it maps out the SPPV families. The entire BPT curriculum for massage branches out from these 4 primary forces: stroking, pressure, percussion, and vibratory manipulations. This SPPV system is your absolute map for literally everything we do in the clinic.
Moving right along to Section 2, Stroking and Pressure Manipulations. This is where we get into the core manual techniques.
Let's talk about Effleurage. This is a firm, deep gliding stroke using the whole palmar surface of your hand, and you need to mold it perfectly to the anatomical contour of the part. It is always directed distally to proximally. Think of this as the mandatory opening and closing stroke for every single session. Its primary job, to mechanically assist venous and lymphatic return.
Let's break this down into the exact key words your examiners are waiting to hear. Your patient is fully supported. You are in a stable stance, transferring your body weight smoothly. Your whole palm is molded to the tissue. Pressure is moderate to deep over the muscle belly, but you have to release that pressure over bone. You're always moving distally to proximally. Observe the animated directional arrows following the venous return, and notice the cross-sectional response of the superficial fascia. The rhythm is smooth and continuous. You're treating edema and muscular tension here, but again, always remember to rule out DVT and acute inflammation first. Building on that foundation, we get to Petrissage, coming from the French word for kneading. These are techniques where the soft tissue is lifted away, compressed, or rolled against the underlying structures. The mechanical intent here totally shifts from fluid return to tissue mobilization. We are actively breaking adhesions, stretching muscle fibers, and improving local circulation through these alternating pumping actions.
All right, welcome to the Petrissage Masterclass. Let's look at the mechanics. For ringing, keep your hands flat and side by side, moving in opposite directions across the muscle belly with moderate pressure. For picking up, use a C-shaped grasp, alternating lifting, squeezing, and then releasing. Skin rolling involves your thumbs pushing a fold of skin while your fingers kind of walk it forward. And kneading? That's a circular compress and release. Now, a quick warning. A classic intern mistake is just sliding your hands back and forth over the skin. Guys, don't just give your patient an Indian burn. You must actually engage, lift, and move the full thickness of the muscle or fascia to actually achieve those physiological effects.
Next up, we have friction. This is a small amplitude but very deep pressure technique. You are moving deep tissue against underlying structures without sliding over the skin surface. The skin literally moves with your finger. A major clinical application here is Cyriax transverse or cross-fiber friction. We use this for chronic tendinopathy, like tennis elbow. You apply deep pressure exactly perpendicular to the fiber direction to stimulate a healing response and remodel that collagen.
Okay, shifting gears now to Section 3, percussion and vibratory methods.
Let's look at tapotement, or percussion. To guarantee you remember the correct order of force for your exams, just use this mnemonic: tiny hands clap big pounds. Let's break it down. Tapping is very light, using your fingertips for delicate facial areas. Hacking uses the ulnar border for stimulating a sluggish muscle. Clapping uses cupped palms to trap air, which is absolutely essential in chest physiotherapy for loosening up bronchial secretions. And finally, beating and pounding utilize a loosely clenched fist, and you reserve those for large, well-covered muscle bulks like the gluteals.
Moving on to vibratory manipulations. Vibration is this fine, rapid trembling movement transmitted entirely from your arm, through your fingers and into the tissue with very light pressure. Shaking, on the other hand, is a coarser, larger amplitude side-to-side oscillation of a grasped muscle, and this brilliantly illustrates how fine motor control yields profound neurological relaxation. You can apply static vibration over specific facial sinus points, like the maxillary or frontal sinuses, to provide just incredible symptomatic relief for congestion. Just double-check there's no acute infection or active nosebleeds first.
Next up is Section 4, regional lines and pressure. Let's start mapping this onto the body.
You absolutely must know the centripetal massage lines. So the crucial point is the face-to-neck, arm-to-pit, leg-to-groin rule. Your strokes must always follow the natural live tension lines and lymphatic watersheds. For the upper limb, drain distally from the hand toward the axillary nodes. For the lower limb, move from the foot up through the popliteal nodes and right into the inguinal nodes. You are always working to assist the body's natural venous and lymphatic return.
And here is your pressure grading scale, VLMDV. That's very light, light, moderate, deep, and very deep. This progresses from the skin level all the way down to the periosteum. Listen, pressure always begins light. You need to constantly read your patient's nonverbal cues. Look for any muscle guarding or breath holding. Only progress to the deep fascia once you have actually assessed the tissue's tolerance.
Finally, Section 5, practical exam mastery. Let's bring everything we've talked about together. Listen up, because these are the absolute most common ways I see interns lose points. First, structure your station using PPDSC, patient prep, self-preparation, positioning, draping, sequence, and closure. Never skip your opening and closing effleurage. Always work distal to proximal. Use your body weight, guys, or your thumbs will absolutely give out in 2 minutes. Communicate continuously with your patient. And above all, if the examiner stops you, take a breath and confidently verbally justify the physiological effects of your technique. You know this stuff.
All right, here is your 10-second explainer recap. Your technique relies on flawless SPPV execution and solid body mechanics. Your purpose is driving mechanical, physiological, and reflex tissue responses. Your clinical uses span from reducing edema to clearing respiratory secretions. And your safety protocols demand that you screen DIMBUS, prep with the 4 Ps, and respect the pressure scale. You know the mechanics from this explainer, but can you actually read the tissue under your hands? Good luck in your practicals, interns.